Nigeria's health sector needs a complete overhaul as it is plagued with a lot of problems ranging from inadequate welfare packages, a lack of equipment, an exodus of its health personnel, amongst others.
Worse still, the absence of a comprehensive and affordable health insurance scheme also has a part to play. Now, there is a need to address key developmental issues within the health sector with a view to fostering sustainable development. How
best can Nigeria fund its health sector and ensure the delivery of quality healthcare services? Joining us in the studio is the Executive Director, Lagos Health Summit, Moshood Habeeb. Thank you for joining us on TVC Breakfast.
Thank you so much. Nice to have you, John.
Now, there has been talks around the health insurance scheme capturing a majority of Nigerians because the figure as it stands, it's quite low. Now, when you look at how it is, would you say that a lot of Nigerians really understand or have been properly educated on the benefits of being captured in the scheme?
I wouldn't say that because most people don't really understand the benefits of health insurance, especially in a country like Nigeria where people don't really believe so much in preparing for future occurrences. So that's one of the problems. Then the second one, like I said, is still our economy. Most people cannot afford to take some amount of money to prepare for something that is not happening now. They want to use their money to solve their current needs, you understand? So preparing for something that can occur in 2-3 years' time is not coming into the money that they have currently. So we need to look at how we can, like you have mentioned, make it affordable for everyone, because the basis of universal health coverage is to make sufficient healthcare service available for everyone, regardless of their class.
And now, especially when Nigerians always leave things to God.
Yes.
We leave it in the hands of God, by the grace of God. But certainly God will not come down to do these things for us. But talk to us about the summit that concerns health. What does this stand to address, and what do we expect from the summit?
Yes, well, thank you very much. Lagos Health Summit is a gathering of subject matter experts, most importantly, decision makers, policy makers, and government officials in the health sector. So we are bringing together the government and private health sector to clarify challenges, provide solutions, most importantly, and these solutions will bring about public-private partnership that would help address issues, key developmental issues in the health sector, basically. But for this year, we are focusing on funding healthcare to help optimize our health sector to meet up to required expectation, because it is really falling short of that. So we are constantly bringing the conversations about health insurance to Nigerians, most importantly, on seeing, number one, the benefits, how we can make it more affordable to them, and most importantly, making it a sustainable and equitable way of funding our health sector, rather than waiting for revenue from the government. So health insurance is something that is of utmost importance to the government, the private stakeholders, and also the citizens. I can explain. For instance, there are a lot of healthcare facilities in Nigeria. They offer very good service that we don't necessarily need to travel out of the country to get them. But these services they come at a cost. So for this business to run efficiently, they'll need customers to actually come to patronize them. But they don't really get much customers like that. Why? Because people cannot afford it. And that's where health insurance actually come in.
All right.
So it makes it affordable for them. So those businesses get more people to come on board. So investment in the health sector keeps growing. Before you know it, we can become one of the biggest countries that offer medical tourism. So our medical tourism can really improve if our health insurance scheme is doing fine.
Absolutely.